if they're forced with dealing with the healthcare exchange and seeing all the problems that comes with purchasing it, the easy thing to do is to dump all their employees off on a public option and pay 8%. So what happens is this is designed to drive everybody to that public percent, but it's just like the big box stores, right? They come in, they have really low prices, everybody loves it, all the mom and pop stores are driven out of business, and then what happens? You keep raising the prices. So it may be 8% today, it'll be 15% in a few years, and we'll end up on single payer. I look at this and it clearly is designed to drive us to a single payer. There's no, either they've never run business before, which is true for most of them, or the plan is to drive us to single payer. And that's what bothers me. This plan is designed to crush the private industry and move us all to socialized healthcare. If they just said, we've got a guy in the White House who said, I won. And that's great. If he came out with Speaker Pelosi and Harry Reid and said, you know what, we won, we're going to have socialized health care, we're going to vote on it because that's what the voters wanted, you know what, they can try to pass it. But they're not. They're saying we're going to cut costs, we're going to make health care better, we're going to insure the uninsured, we're going to bend the cost curve, it's also going to cut the deficit. Come on. Who are you kidding? This plan is not designed to help. It's designed to drive total health control over to the government. That's the goal.
Thank you. Thank you.
Today I have my twins with me, and my babies were born at 26 weeks, and they're $1 million right there. And fortunately, we had wonderful coverage through our private health insurance company, which I feel saved my children's lives. I remember calling them on the phone, and I said, how much will you cover? And they said, whatever is medically necessary, we will do for your children. From the time I was 7 weeks along, I went to the doctor every week, and we racked up incredible costs, and we saw specialists and things. And my children were given a 30% chance of even living, much less they were told they would have disabilities and things like that. My concern is in a society that doesn't value life, such as children, like mine. How much will the government pay? Will they pay $1 million for 2 little lives? Or will they say, you know what, this is too much? My doctor also thought that I could be admitted to the hospital at the point of viability where his every other doctor in his office said, you've got to wait till 28 weeks because after that point, your mental impairment is gone. My babies were born at 26, and they are here because of my wonderful insurance company that I will be happy to keep.
I'm currently for families there and can't hear, and I have cochlear implant who's helping me here. And I'm in my second year of college this semester. Now, if I didn't have my cochlear implant, I wouldn't be able to hear anything except maybe a jet engine, of course. So with my cochlear implant, I can talk on the telephone, I can talk to my friends, like warm conversation, and I can hear music and all those stuff. If I didn't have it, I wouldn't be able to do all those things, which is wonderful. Now, the cochlear implant I have is really inexpensive because it currently costs $50,000 to $60,000 per year. So that's really expensive. Now, after this surgery, it's important to receive the correct education afterwards with a child in one hospital. It's expensive to educate a child that is hearing impaired. Now, it's also expensive to provide services for those children who's deaf and not well. Now, there are interpreters that are needed to provide services for these deaf kids so they can be able to communicate with hearing people. Like I can have an interpreter and talk to you. So if we didn't have that, we wouldn't be able to communicate with you guys. Now, when my mother told me about the health care bills being considered by the House and Senate, now they impact the disabled people. I wanted you to know how that would impact me and how difficult it would be to succeed in life without the service that I have received. Now, Ezekiel Emmanuel, Juan Emmanuel's brother, who was involved in the wording of the House bill, said medical care should be reserved for the non-disabled, not given to those who are not prevented from being or becoming participating citizens. Now, does that include me if medical decisions are being made by the government, not by my doctors, my parents, or me? I would be determined to be too expensive to receive the services I need to be able to navigate my way into the world. Now, this is a bad plan for those with special needs. Now, I need to tell Senator mccaskill to vote no.
My name is Paul Kerman, and I've got two things for you to take back to Senator McCaskill. The first is, we don't live in a democracy, we live in a constitutional republic. Senator McCaskill and I both have something in common. We both at one time took an oath to defend the Constitution. Her oath took her to Washington, my oath took me overseas with a rifle. My Constitution that I took an oath to, I know that all the powers of the legislative branch of government are confined in Article 1, Section 8, and they have less than 20 enumerated powers. And nowhere in there, as was already touched on earlier, nowhere in there is health care mentioned, which is really health control, which was also mentioned. It's not mentioned anywhere in there, so she has no business except fighting against it. The other thing, I've mentioned this to politicians before, and they take the Constitution and they turn it into some kind of huge elastic document that they try to wrap around everything. If you read our founding fathers, even they said that the General Welfare Clause, which is what she's probably going to try to use to explain this, even the General Welfare Clause, our founding fathers, Thomas Jefferson, James Madison, the father of the Constitution, Benjamin Franklin, and so on, so on, so on, every one of them said that the General Welfare Clause is only to be used within the confines of the enumerated powers in Article 1, Section 8. Claire McCaskill, I'm not so much looking for an explanation from her as I'm looking for an apology, because this should not even be
My name is Judy Randazzo. I'm from Franklin County, Missouri. I'm a registered nurse. I've been a registered nurse for almost 40 years. I have several questions for Claire McCaskill. First of all, it's our understanding that the health care reform